Today I'm going to be talking about testosterone. And I know we generally think about men's health when we're talking about testosterone, but in this video I'm going to be talking about testosterone replacement therapy for women. Yes, women have testosterone, women need testosterone, but in much smaller amounts compared to men. So as a woman speaking, I'm going to say we need testosterone for our energy, for our muscles. Our muscles need testosterone, our brain health, our skin, and our libido and overall sexual health. So as we get older, testosterone levels do decline, and it's common for me to hear from women in menopause that they may notice some big changes in these areas. So they may notice a drop in muscle strength. So maybe it's harder to open a jar, or you find that you're dropping things. Changes in energy, feeling more fatigued. Changes in brain health, more brain fog. Changes in skin, more sagging skin. And probably one of the most common symptom or thing that I hear is a change in libido. Some women in menopause say, I feel like my libido is just gone. So testosterone replacement therapy in women may be very helpful. And the reason I say may is because your hormones are a complex picture, and it's about balancing your hormones. So there's 4 key players that we think about: estrogen, progesterone, cortisol, and then testosterone. So testosterone, again, can be very helpful in these areas, but prescribing and monitoring testosterone is very different for women compared to men. Again, we need much smaller amounts. So with proper dosing, proper monitoring, and then prescribing testosterone, this can be really helpful in helping you feel more like yourself again. So maybe improvements that women may see would be more energy, increase in muscle mass, and increase in strength, of course, combined with a good exercise program, improvement in brain health and with brain fog, and then libido and overall, again, sexual health. So we're all unique. Every woman is unique, and our hormone picture is unique. So prescribing hormone replacement, including testosterone, should be personalized for a woman. Everybody is different. So the naturopathic doctors and medical doctor at Vitalia Healthcare are trained and highly experienced in prescribing bioidentical hormone replacement therapy, including testosterone replacement for women, that is personalized for you. So for my patients in perimenopause and menopause, I recommend all of them be tested for testosterone. It's a simple blood test. The test I recommend is called bioavailable testosterone. So it'll look at your total testosterone, your free testosterone, and then sex hormone binding globulin. And if you're low, consider testosterone replacement. Again, helping you feel more like yourself as a part of balancing your overall hormonal picture, and choose a trained and qualified medical practitioner. Thank you.